we see that in many traditional Ayurvedic medicines, a single medicine is indicated in many diseases. How can we substantiate this?
Ayurvedic medicines are administered based upon the wisdom of the physician. Yukti plays very important role in that while prescribing the medicine for any kind of patient. Because in Ayurveda it is believed that every disease is because of indigestion. So the first intention of any of the formulation is to give good appetite to the individual, because all our food should pass the digestive fire. If digestive fire is not proper, rest of the things, because the nourishment of rasa, rakta, mamsa, meda, asti, majja and shukra dhatus is not possible, because the disease is caused in these dhatus only. That is, they are called rasagata vikaras, raktagata vikaras, mamsa, meda, asti, majja and shukragata vikaras only. So when the disease is caused in the particular dhatus, management of that is possible only through the food. And in that incidence, first intention is to give the digestive fire. Importantly, let us take the example of Sitopaladi Churna. Sitopaladi Churna contains Sitopala Shodashau Syat, 16 parts of sugar candy, Ashtau Syat Vamsharochana, 8 parts of bamboo manna, that is called Vamsharochana, Pippali Syat Chatushkarsha, 4 parts of Pippali, Syat Elach Dvikarshaki, 2 karsha, 2 parts of Ela, cardamom, Ekakarsha Tvachaha Karya, 1 part of Tvak, Churna Ye Sarvamekataha, Sitopaladikam Churnam Madhu Sarpi Yutam Lihet. In this way, if all the ingredients are mixed together, that is called Sitopaladi Churna. But that formulation should be administered along with Madhu Sarpi Yutam Lihet. It should be mixed along with ghee and honey and administered. This formulation is appreciated as a very good drug in the treatment of cough, especially in the conditions of dry cough. So to get the maximum benefit, the drug should be administered along with honey and ghee. In the classical literatures, they have emphasized the dose of this drug as 12 grams. But in practice, nowadays, it is administered only in the dose of 2 to 3 grams. That is the hurdle of Ayurvedic practice. The drug should be administered in a proper dose, otherwise we are not getting the desired benefits. Being a formulation which is well appreciated for cough, it is having multiple utility, like Mandagnim, in the indigestion conditions it is useful, Supta Jihvatvam, in case of numbness of the tongue, that is having benefit, Parshashulam, in case of pain in the flanks, Sitopaladi Churna is finding its utility. Jwaram, in case of fever, also it is beneficial. Urdhvagata Rakta Pitta means bleeding from the orifices of the upper orifices. In these cases also it is finding utility. But people appreciate Sitopaladi Churna only for the conditions of cough only. What then question arises, what makes this difference? A single formulation is having wider utility because the form, how it is arranged, based upon that it is producing its action. Even though its main indication is cough, it is having soothing benefit. So it is indicated in Rakta Pitta, bleeding disorders. The formulation is having Vamsharochana, which is giving strength to the body, which is a supplement of calcium. So it is indicated in Parshashula, pain in the flanks, especially if a person is tired or feeling exhaustion because of constant cough. Much energy is needed, and that is fulfilled by Vamsharochana. It is appreciated in indigestion cases. Mandagni, it is having Pippali, that is causing the good digestive fire. It is indicated in Aruchi, anorexia, because it is having Tvak, that is helpful to overcome the tastelessness. Altogether, it is producing, being a formulation of indicated in cough, it is having wider utility. That is applicable for many of the formulations, the Ayurvedic formulations also. Example, Chitrakadivati. Chitrakadivati is a very good formulation which is appreciated for the cure of constant indigestion or chronic indigestion. It is having Chitrakam Vippali Moolam, Doksharau Lavadanicha, Vyosha Hingu Ajamoda, Chavyam Chaikatra Churnayet, Gutika Matulungasya, Dadimasya Rasenava, Krita Vipachayatyama, Deepayatyashuchanalam. This formulation is having Chitraka, Pippalimola, etc. ingredients. But when it is triturated well with the citrus medica, Matulunga, its nature, that is Chitraka, is more penetrative. That quality will be subside, coming down, and only the required percentage of the carminative benefit is obtained from that drug. Application of this is, being a formulation which is mentioned well for diarrhea and dysentery, it can be used safely in irritable bowel syndrome conditions. That is the advantage of that. Other than this, a physician who can apply this and he can utilize this formulation even for the conditions like acid peptic disorders, or in the conditions of gaseous distension of abdomen, in the conditions of abdominal pain, etc. He can utilize this formulation. One more example I can cite, Rajapravartini Vati is a classical Ayurvedic formulation which is indicated in dysmenorrhea. A skillful person can utilize same formulation in case of jaundice also. And it is a general notion that Rajapravartini Vati, Rajaha Pravartana, which induces or facilitates the menstruation. But a skillful physician, it means the drug is indicated only for women. But a skillful person can administer this medicine for male also, especially in case of, in male as well as in female, if their patients are suffering from jaundice, obstructive jaundice, that can be administered, because the mechanism of obstructive jaundice and dysmenorrhea are same. Where bile is obstructed, it may be obstructed in the liver in case of jaundice, or it may be obstructed in case of uterus in case of Kashtartava, dysmenorrhea. But skillfully both can be administered tactfully in these two extremities.
You mean to say that, as per Ayurvedic principles, the obstruction is a cause for jaundice and also is a cause for...
Yes, obstruction of bile is the cause in both the cases. If suppose obstruction of vata is there, I can give a good example.
Obstruction of bile in the sense pitta.
Yeah, pitta. If obstruction of vata is there, good example is Hingvashtaka Churna. Wherever the vata and kapha is obstructed, Hingvashtaka Churna, which is commonly known as Astachurna, is a very good drug. Whereas mere vata is obstructed, Dashimuladishna may be good.